Good afternoon, everyone. My name is Hayley Thompson. I'm a professor here at Wayne State University in the Department of Oncology in the School of Medicine. I have a couple of other titles, but for today, I'm going to focus on my role as Director of Checkup, the Center for Health Equity and Community Knowledge in Urban Populations. We really welcome everyone who's attending today, and I'm really excited about having a conversation today about the opportunities and challenges of community engaged research. I'm going to I'm going to ask our behind the scenes person to move it to the next slide. So what we're going to do today, we're going to talk about Checkup and provide an overview and some updates. So we've been functioning since the fall of 2021. And so I want to get everybody up to speed on what we've been doing. Here in the slide, you can see our website, check-up.wayne.edu. And then following that, I'm going to do this along with my colleague, Dr. Carrie Leach, who also works with Checkup as an Associate Center Director for Community Inclusion. And then we're going to move to a really, I think, lively panel discussion with some of our colleagues here at Wayne State University to talk about how community engagement has been a part of their work and their research. So with that, let's keep moving ahead. So just a background on Checkup. So some of you, I think on the Zoom probably have been involved with Checkup in some form or fashion. And for those who haven't, here's just a really brief background because it took a lot to get to this point, but we were basically established in the fall of 2021 following the Wayne State University's Bold Moves initiative. And you can always Google that and find the information about what that was, but the university really sought ideas from faculty and staff and students that would be transformational. So Checkup was one of the ideas that was selected among several. And Checkup is really driven by the imperative that Wayne State University would prioritize and promote shared leadership with our community members and stakeholders when it comes to medical and behavioral research. And this is the kind of the basis of CBPR, right? Community-based participatory research, CBPR. If you take a look at the figure to the bottom right of the screen, that gives you some idea of what we mean when we talk about community involvement in research and participatory research. It has to do with level of power and control that's shared between researchers and community members, responsibility and ownership, participation, and influence over projects. So really, if we, in a nutshell, one of the primary or overarching goals of Checkup is to facilitate and accelerate community academic partnerships for health equity research and programs. And lately, I've been thinking about the role that Checkup can play in advancing the science of community outreach and engagement. So we have a huge task ahead of us. Next slide, please. So this is some overview of the structure of Checkup. In terms of the health equity priority areas, there are 3: cancer control, cardiovascular health, and mental health. And we've already been building research networks focused on certain populations, specifically LGBTQ populations, MENA, that's Middle Eastern, North African, refugee and immigrant populations, and African American or Black populations. And this work is really built on existing work that has been integrated with what we're doing now or is closely aligned, including our Karmanos Office of Cancer Health Equity and Community Engagement, which is another center or initiative that I help to lead. And some of these other programs and resources I'll be talking about as we move forward. But I also want to talk about kind of the core principles and practices of Checkup, because I think it's really important. I know that there is certainly a lot of health disparities research happening at Wayne State, a lot of health equity initiatives, but I also think that it's not only what you do, but it's how you do it that makes a difference. And I think we've learned a lot of lessons, particularly from this pandemic, about the importance of community inclusion and partnership, and how important it is to be guided by certain values so that we don't reinforce or reproduce inequities or disparities. So in terms of our core principles and practices, they include community-based participatory research, as I mentioned. Again, that has to do with including community members in all phases of the research process. We really have a behavioral medicine focus, which is really, and behavioral medicine, for those who are not aware or not familiar with that term, is really an interdisciplinary field that brings together people from the medical sciences, social sciences, to focus on health. the application of a social ecological model, right? So we think about different levels of influence when it comes to health outcomes. So we think about the policy and legislative level, what's happening at the community or neighborhood level, institutional level, interpersonal and individual levels. Public health critical race praxis, which is really focusing on the kind of the role or the fundamental role of racism and kind of hierarchies and oppression in health disparities and in driving health inequity. And really taking an anti-racist approach to the work that we do, which I think is critical, and transdisciplinary team science. So we want to bring together people of different backgrounds who use different approaches to create something that's potentially more than the sum of its parts. Next slide. So I'm going to move through these pretty quickly in terms of our goals. We have 4 general goals. The first is to increase our university's capacity for identifying, investigating, and intervening on barriers and creating bridges to health equity through inclusion and training of our faculty and staff. So when we first started writing this, we got the buy-in and interest of at least 29 faculty across schools and colleges to do this work. And we hope that that will expand as we move forward. We've done some workshops and trainings. You can see there, we had a one last year that focused on PCORI engagement awards. We've done presentations at external conferences, and really one of our signature programs is our Community Engaged Research Symposium. We've been hosting these as annual meetings since 2018. Last year, many of you, hopefully you were able to be a part of this. Those of you in the audience, it was actually a series focusing again on the 3 populations I talked about before: LGBTQ populations, Black populations, and what we're calling minority groups. And it was a pretty successful event, even though virtual, with the 375 participants across 5 different symposium meetings. Next slide. So our second goal is to create formal pathways to increase our our university faculty and staff and students access to community knowledge and to accelerate, again, those research partnerships for health equity. So we are guided by a steering committee, and that includes our chair, Lisa Braddix, who's the health equity director for the Southeast Michigan Health Association, CEnR. And then here at this list are organizations that either were part of the original Bold Moves application and signed on to that, or have been a part of our steering committee, or we're part of the planning and presentation of our Community Engaged Research Symposium. So we are definitely continuing to build a really, hopefully, a strong base and network of community organizations who are interested in partnering with Checkup and the university in this work. Okay. So just give us a second there, Alexa. Okay. I also want to highlight our Faith Community Research Network, which is our network of churches who are coming together every month, again, around research and health equity. This was actually established before Checkup in 2020 in partnership with another community-based organization, the Faith-Based Genetic Research Institute. And so since that time, we've been working with the small network of churches, teaching them about research, developing research priorities, and creating programming together. And in 2023, we hope to expand this network. But we, again, wanted to take time to build partnership and to build relationship. And I say this all the time, that a lot of this work around CBPR or community engaged research is about relationships and what are you investing in those relationships and how are you sustaining those relationships. Next slide. So just to share a little bit of the work that we've done, we actually with this network successfully, we obtained and completed a PCORI grant around the faith community and involving them in genomic research. So really focused on genetic and genomic literacy. And that culminated in November of last year with a series of programs called The Future of Medicine is Now, focusing on precision medicine and precision oncology. So you can see some of the images there to the right. And then we've also created some TV programming, our Medical Mythbusters series that's going to be launching in the spring in a couple of months, where we worked with and interviewed some of our Wayne State University faculty and staff around, again, hypertension and heart health, cancer, and COVID-19. So that'll be appearing soon. You can see some of those images at the bottom. And we're also going to be preparing to launch a faith community health survey. So we intend for this to be a longitudinal assessment of church-going or church-affiliated African Americans that will allow us to, again, create interventions and target other areas of need. Next slide. We also, the third goal as part of Checkup is to build capacity in Metro Detroit communities. So we do this in a couple of ways by teaching folks about research. So We have already done this work within our cancer center through the Building Your Capacity curriculum. We've had over 100 people across the state complete this 9-module curriculum that really is a really strong introduction to research, but then we've taken it a little bit more, we've gone more in depth with this work as well. Next slide, with our Community Health Scholars Program. So this was initially funded by the Total Healthcare Foundation and was designed to offer resources to increase community involvement and participation in research, either as collaborators, consultants, as CAB members, community advisory board members, community co-investigators, but also potentially, it could potentially give someone a foundation to serve as or receive employment as a research staff. So again, that course was called Building and Applying Research Skills. We piloted it last year. We're going to be offering it again this year, and I'll say a little bit about that in a few moments. But we received a really strong interest in this program with over 60 applications from Metro Detroit residents. We only had 12 spots. We're able to actually include 14 people, and 11 people completed the program. Next slide. And just giving you, so these are our scholars who completed the program, the Community Health Scholars Program last year, and they are still doing an experiential piece of it even now as we speak. But again, 55% lived in the city of Detroit, and a really nice age range going from 20s to 70s. Next slide. And certainly we're doing all this foundational work so that we can actually develop interventions to advance health equity, right? And so right now, this is being guided by our work groups. We have 3 research work groups focused on the populations I mentioned before to help develop these interventions and gain consensus around areas of focus. And we really want to move towards multi-level intervention development and implementation. Next slide. So I'm going to talk quickly about, I've got a 1-minute warning, our new funding from CVS Health that helps us do this work. So we were very fortunate to partner with CVS Health and receive funding from that foundation to be, and that allows us to be part of this Community Equity Alliance. They've also funded partner institutions at, in Nashville, Meharry Medical College, and Sinai Chicago. And this work is, again, focused on health equity and creating partnerships with historically marginalized communities. Next slide. For our work here in Detroit, we're focusing on persistent poverty census tracts. And you can see everything in orange, or those orange spots represent the persistent poverty areas in Wayne County. A lot of those are in Detroit, representing over half of the census tracts in the city. Next slide. So our goals here are to create a multi-sector community coalition that serves those areas and to work across sectors, across organizations, and also with residents to develop priorities when it comes to cardiovascular health and mental health, and to work together to plan and implement activities and in the long-term interventions. Next slide. The second aim with this is to conduct key informant interviews with those coalition members. Next slide. We want to provide training opportunities for those community stakeholders. So we're going to continue to offer our Building Your Capacity curriculum. We're going to continue offering the Community Health Scholars Program to a wide range of community members and stakeholders. Next. And then we want to offer training opportunities for our faculty, staff, and students here at Wayne State so that we can really be effective and have the right skills and strategies to develop and sustain these types of partnerships. Okay, next slide. And this is our team. I want to acknowledge Dr. Carrie Leach, Lisa Braddock from SEMHA, Dr. Elizabeth Towner, Family Medicine, Jason Carbone, Social Work, Dr. Sneed, Institute of Gerontology and Psychology, and 2 of our managers, Tanaya Kinney and Alexandra Sass. So I'm going to turn it over. I know we're a little bit over time, but I'm going to turn it over to Carrie Leach.
Thanks, Haley. Thanks so much. We learned that everybody that clicked on this Teams link is rerouted to Zoom, so everybody's in the right place. It's great to know. Thanks for that. So we just wanted to give everyone an overview of the kind of things that we're hearing in terms of strengthening community academic relationships, and want to highlight that at the end of this, we will let you know about our upcoming workshops, and those will be grounded in the kinds of things we're hearing from people that have attended our workshops or the symposium. And also our steering committee members are represented in these small boxes you'll see on the slide. So some of what I have here is pulled from our Community Engaged Research Symposium that Haley mentioned. I have a count of 381 people attending that in the fall, which was really exciting and definitely demonstrates interest for programs. So some of what we're hearing is that community partners and academic researchers are asking for help to reduce the kind of institutional barriers that they face in doing this research, anywhere from having space to hold meetings where you can eat and commune, to compensation processes and parking, right, that impede being able to gather. Also, the need for support and training. Our first program will be focused on building capacity through sharing resources among academic researchers and community partners, and that will be held at the end of April. We'll tell you more about that at the end. And establishing shared language. One of our steering committee members, actually from Checkup, asked for us to begin our process by offering foundational information of the kind of principles that undergird Checkup, like you heard Hayley talk about critical race theory praxis, community-based participatory research. How does that differ from community-engaged research? And also improving listening skills among our researchers, and the ways that they can interact in their communication skills as well. A lot of interest in shared data and findings, obviously, so the community members can use that information to make change and advocate for improvements in their communities. And for the university to demonstrate value for community engaged research, not only in and among their teams, but also in like promotion and tenure processes. And we'll really get focused around training researchers. One of the things we're doing in CURES right now is thinking about ways to leverage the resources available within Wayne State through the Office of Diversity, Equity, Inclusion to upskill our own community of scholars, but is also offering that to community stakeholders and their organizations and members as well. So just to give you an overview of the kind of needs that are here for people to do this work. And I'll stop there and hand it back over to Hayley to introduce our moderator and our exciting panel of speakers.
So thank you for that, Carrie. That's a really great overview. So as we move into the next section, I just want to talk a little bit about some work that's been done. It's article's a little dated, but I think it still really applies. I mean, we were deliberately made this a very faculty and staff focused listening session and panel because as we embark on this work, we want to make sure that we are providing resources and support to make it easier to do this work and to make it and to really we want to highlight the benefits of doing this work, because I do truly believe that it leads to stronger science. So, and improved outcomes. So I just want to share this work from Allen et al., Model for Facilitators to Faculty Participation in CBPR, Participatory Research, Community Engaged Research. Certainly at the top, you have researchers' personal attributes. One of the things that I like to always talk about here is you sometimes need tolerance for ambiguity, right? And but also what's important are your attitudes towards collaboration, and this type of work maybe having non-hierarchical kind of approaches to working with people, you're being willing to share power and control. There certainly is a box there in the center there for researchers partnership building skills and knowledge, because certainly, again, you need to have some proficiencies in this area. And then, but also what's really important there is that box to the right, institutional facilitators. What is Wayne State University doing or not doing that affects this type of work? So hopefully we can dive more into some of these issues as through our panel. So right now I'm going to turn it over to Dr. Rodlescia Sneed, our moderator for today.
Good afternoon, everyone. I'm really happy to be here today to serve as the moderator for this very important panel that we are hosting today, focused on community engaged research. I'm joined by three wonderful panelists who have a diverse range of experience doing community engaged research. Dr. Harper, Dr. Runge-Morris, and Dr. Miranda-Hartsuff. So I would like to start by having each of them briefly introduce themselves and tell us a little bit about who they are and an example of any type of community engaged research that they do. And so we'll start with Dr. Harper.
Good afternoon, everyone. Thank you so much for inviting me to be here. I'm really thrilled to be part of this panel. I am very fortunate. I should say I'm a clinical psychologist, I'm a professor, and I also am the Associate Center Director for Population Science Research at Karmanos Cancer Institute, which really gives me the ability to be able to further our population science research agenda, both at Karmanos as well as across our McLaren Health Network. And I am very, very fortunate in a project that I have now to collaborate with Dr. Thompson. So we are MPIs of an R1 project that is working with the African American community of cancer survivors. And we have, using the HealthLink model that COE and OTIC has, we have been able to form an action council of community members. So as part of that research, we have community members as active collaborators all the way from designing the model to dissemination. And that's now a study that we have ongoing, and a really great, to me, thrilling and great opportunity to be able to work with the community that we serve.
Wonderful. Thank you so much for joining us today. Dr. Runge-Morris.
Hi, thank you very much. So I'm Melissa Runge-Morris. I'm the director of the Institute of Environmental Health Sciences at Wayne State. And I'm also a professor of oncology. I see patients on the lymphoma leukemia service every Tuesday. And I wanted to share with you the fact that at the Institute, we are the home base of two very important environmental health sciences centers funded by NIH. One is called the Center for Urban Responses to Environmental Stressors, CURES, and the other one is a newly funded Superfund research program called the Center for Leadership in Environmental Awareness and Research. And both of these environmental health sciences centers have as a requirement the inclusion of a community engagement core. And the reason for that is probably the same reason I went into the field of environmental health sciences. In cancer care and cancer research, the actual desired ideal would be to prevent cancer in the first place. So disease prevention is a very important part of the cancer field. And in environmental health sciences, that's what we're all about too. You know, we have genetics, but everyone is part of the environment. And that includes social determinants of health as well as environmental contaminants that might be legacy from old factories in Detroit or emerging contaminants. So these all of these factors influence human health, and we need to understand the underpinnings of disease prevention a lot better. And in order to do that, community engagement is essential because, you know, there's no environmental health sciences clinic, right? There aren't clinic patients coming to our institution for that purpose. We have as our audience of our work, it's the community itself. And community engagement is paramount importance if we're going to move forward toward our goal, which is a healthy Detroit.
Thank you. Thank you very much.
Sorry. Yeah.
Dr. Miranda.
Hi, I'm Tricia Miranda-Hartsuff, and I'm associate professor in the Department of Public Health here at Wayne State. And since I arrived in 2020, I've been working on building the Hub for Evaluation and Learning, or HEAL Detroit, where we're really focused on trying to address those structural, more upstream factors and work in partnership with community members to really, ultimately what we're trying to do is really shift the power back to communities within community engaged, community-based work. A lot of the power generally has continued to rest with the universities in those relationships. And so we're really trying to shake things up and come up with a different model that really puts that power in the hands of community. And the most recent example, I was fortunate in our really first partnership was with a Detroit nonprofit, Accounting Aid Society. And they actually were the ones that were awarded the initial funding. And they came to us to look for additional expertise in some survey, really trying to understand barriers that folks have in filing for their taxes. Their funding was from the AARP Foundation, and the EITC credit was expanded for last year's taxes. And for a substantial percent of families, that tax refund check ends up being the largest check that they might see all year long. Increasingly, state rebates, or imagine the home heating credit, for example, they are tied to individuals who have filed their taxes, and they receive those funds more directly if they have filed for their taxes, for example. So we worked with them to help find the answers to some of the questions that they were searching for. And right now I'm working with a group that we have funding from the CDC Foundation directly. And we are actually, our Wayne State group is actually brought on as the Community Steering Council. There are also academic partners that are involved in the process, but we are actually the community partners because we have the time and resources to be collecting the data when they do not. And I'm actually quite proud that we're identified as the community partners for that funding. So that's just the most recent.
Wonderful. Thank you all so much. So you've already addressed this to some extent, but I want to ask, when you hear the phrase community engagement, what does that mean to you in your work? Dr. Harper, do you want to start? Oh, you're on mute.
There we go. To me, I think that community engagement really is about developing a bidirectional collaboration between academics and community members. And I think that it's really creating kind of an equal foundation from which, in my experience or with what I'm doing now, is making sure that we know and understand what the priorities are for the community, what they think is important. Because I think obviously as researchers, we can bring, we have expertise in the research literature and what the evidence says and how to design a study and what we think is important. But I think more importantly, and particularly for those of us who don't belong in some of the communities or aren't part of the communities that we study, we have to have kind of a fundamental understanding of what it is that is going to have the most impact and is most important to that community. I think far too long, researchers have sort of sat in their ivory tower and designed these studies without really a knowledge of whether it's important, whether it's valid to the concerns, whether it's valid to the community. And I think it's important to make community members part of our research teams and are even designing our research ideas from the very beginning, so that it does really become a true collaboration. I think part of that is about, again, for those of us who are not part of the communities that we're studying and we don't have a good basis of trust within that community, I think it's really important for us to build that trust and rapport. And it's also really important for us to be responsive to the things that the community members are saying or not saying. And I think that really is what drives sort of the ecological validity of our research. But even over and above that means that we are actually benefiting the community that we serve. And I think that is, to me, one of the most critical things is we can't benefit communities without involving communities in those efforts.
So really engaging with community partners in a collaborative way in order to ensure that we're actually meeting the needs and concerns of the community. Mm-hmm. Do you have anything to add, Dr. Miranda?
I would agree with that. Yeah, if we're distinguishing community engaged from community driven, yes, I would say.
Okay. Dr. Runge?
Right. So I also adhere to everything Felicity was saying, and to say that because of the need to engage the community and take the pulse of what the top priorities are for the community in environmental health, we've come to include not just a community engagement core and community advisory board in our center, but actually include community members in our governing bodies within our center, such as the Internal Advisory Committee, which includes all the scientists who are program leaders and core leaders. And actually, as a result of one of the community advisory board meetings, where community members were frustrated with how we selected pilot projects for funding, how was that done? It seemed, kind of like a black box almost of question marks. So the community members actually received education on pilot project reviews and now participate in it, which was good on both sides for the review of these competitive environmental awards. So I think that a lot of what we do moving forward is to include members of the community in kind of everything we do.
Mm-hmm. Mm-hmm. Yeah, that's an excellent point. And we'll talk a little bit later about how you all do that specifically. So you all have talked about the ways in which community members are deeply embedded in the work that you do. But let's go back to the beginning. How do you actually go about recruiting and identifying community partners to participate in your work? Dr. Harper?
Well, I think that many of us at the Wayne State and Karmanos community are very fortunate to have resources available to us that can help us with that. So, for example, the Office of Community Health Equity and Community Engagement at Karmanos is a program that has developed a lot of ways for researchers to be involved and to engage with the community, having established many of these critical relationships. Mm-hmm. But nevertheless, even their relationships are not our relationships. It's really incumbent for us as people who go to work with these communities. And so whether it's something there's already an established, academic community collaboration, or in fact, if you're going into a new area and where you are going to partner with organizations or a community that you do not already have a relationship with, I think one of the most, to me, the most critical thing is you have to establish a rapport with that community, and you have to address, issues of mistrust. So, I think for some communities, some populations, for example, I work with African-American cancer survivors, there's a long legacy of medical mistrust, both related to historical events as well as things that happen now. And there are a lot of concerns about what's going to, as from a research perspective, what's going to be done with my data, how, why should I want to give you, why should I want to give you access to my life? Why should I want to participate? And I think it's really, really important before you dive in with starting a research study is to understand and to listen and to ask lots of questions and to answer questions and to establish that there's a comfort level, or at least a basic structure of trust that you can move forward, in which, you as researchers, we have to earn trust, right? And so there has to be some reason that the community wants to partner with us and that they want to move forward with us. Very often due to things that are a normative response. There's one quote that I always use in terms of working with the African-American community, is that one of the research participants said, that in the Black community, there's a lack of faith in doctors. And there's a good reason for that, is that in the past, and even currently, doctors have not treated Black people well. And they're not good to them. And to me, that really speaks to this idea of, if that for this community, if that's something that's a starting point for us to say, we understand where you're coming from. We understand the reasons why you might have absolutely no interest in partnering with this. Can we reach common ground in terms of understanding how this is going to benefit for you, what we're going to do with our research? And let's talk about that before we ever dive into what the research questions are. Very often I think that's what happens is we have a research study, we want to do this in your community, tell us how we can be helpful. And I think that, you're sort of missing the point if you don't start at the very basis of how can you trust us as researchers.
No, that's a very excellent point. I think researchers are often guilty of coming in with a predetermined research question that may not reflect community needs and values, and just establishing rapport and trust and understanding a community before you actually start a research project is critical in building that trust. Dr. Miranda, do you want to add anything to that?
I would, because actually with Heal Detroit right now, we're in the process of working to build our community steering council for a project. And we are quite intentionally trying to identify organizations who are perhaps representing populations that haven't really, we talk a lot about having a seat at the table, and perhaps who haven't historically been represented at the table with academic partnerships, because I think certainly, I mean, this isn't new work going on in academia, and certainly there have been a number of institutions from outside Detroit who have long histories of working with community partners. And so really working, to make sure that the work that's been going on so far hasn't just become too comfortable, perhaps, and that we actually are having all the voices at the table. And so I just had a meeting Friday with one of my community partners, for example, who, as we're identifying these new organizations, what he said was that we're really looking to do important work on behalf of some of the most marginalized people who don't have the resources, but have access to the networks of people. And a lot of times that might mean that they're cash-strapped organizations right now, and they just kind of need that additional funding to help them go forward in their work, versus perhaps some of the more established organizations who have become that because of their past partnerships with universities. So trying to find, who hasn't previously been represented.
Yeah, I think that's an excellent point. If you're thinking about, we have partners that we work with again and again, and sometimes there are smaller organizations or newer organizations that represent important groups within the community that we may not have interacted with, and the importance of really trying to replenish our networks and ensure that we're getting a diverse range of partners is important. Absolutely. So I'd like to talk a little bit about the ways in which you embed community partners in your work. And so when we hear about community engagement, we often hear about it in the context of study design or study recruitment. But can you talk a little bit about how community partners engage with you sort of in the later phases in your work? So in dissemination, for example. Dr. Runge, do you want to start?
Well, you kind of picking on the most different person in your panel, because I am an oncologist, a clinical oncologist, but first and foremost, a basic scientist. I work with cellular models in the laboratory to understand molecular mechanisms. So I was not a trained community engagement or participatory research scientist at all when I started the Cures Center back in 2012 and took us a couple of tries. I learned from the ground up from Peter Lichtenberg, who was our first community engagement core director and was familiar with how you even begin to do community engaged research. The Cures Center and to a certain extent the CLEAR Center are prohibited from doing community participatory research. That's a separate grant mechanism for us. So we're strictly speaking community engagement, and that those cores have their own requirements. But I couldn't have done it without people like you on this panel, people who are experienced and knowledgeable about the percepts of community engaged work, because without, that's a gap in medical education, isn't it? And in PhD education as well. When you look at it, the RFA came out for the center. Let's take a look. Community engagement. We have to learn more about that. And so that's not the only thing, that now they're requiring giant data centers. Oh, we got to find somebody who knows what that's all about. So we're always being challenged. I think that's one of your questions for today, is always being challenged by NIH to expand the way we think about our work. And that's also the fun part, to really push the envelope for how to make this meaningful and how to take it to the limit of discovery. So anyway, I don't know if that answered your question, but it's a perspective.
Yeah, absolutely. I think there's several of us who probably would say similar things, that we weren't necessarily formally trained in community engaged research, but we saw a need, and we sought counsel from those who had more experience and have worked to sort of develop this area of work for ourselves. Dr. Harper, can you tell us a little bit about your experience in engaging community members further downstream in terms of dissemination or other activities beyond recruitment or design?
Well, the approach that we have taken, and it's one that I think we have used across multiple studies, is this idea that community members are with us from beginning to end. So we started with community members in our R1 study looking at quality of life in African American cancer survivors. With researchers developed a model, and then we said, all right, we're going to work with the community to refine this model. So the model that we had even before we started was collaborative. Now we're doing a longitudinal study actually testing that model. And again, community members have been with us every step of this way, providing, advice, guidance, and partnership around recruitment and data collection and all of those things. But that was not where it started for us. And now then, as we we'll start moving into the later phases of the grant, that this part is really focused on some of the things that, Dr. Thompson mentioned, and doing boot camp translation. And in that sense, what that will be is that we will present the findings of what we have and really work with the community in partnership to make sure that they understand the findings, and for us to better understand what might their interpretation of the findings give us. And I think from that point in time, it's going to be a process of us jointly deciding, well, what are the messages that are going to be that we want to take away from this research? What are the messages that we need to take back to the community? How is it that these messages need to be disseminated to the community? What kinds of forums will it be? And this will be something that will be a joint and equal effort between us and the community in terms of helping us to kind of identify the messages and develop an implementation plan, as well as selecting the venues and avenues in which we will disseminate that information, and then ultimately what the next steps will be. Are there more things that we need to do with these messages and other avenues, and what will the next study be? So in our kind of a framework is that community members are really, as long as we're at the table, they're at the table.
Yeah, that's a really wonderful approach. I particularly like the fact that you share findings with community partners and are sure to incorporate their interpretation of your findings as well. Because often as researchers, we have a lens and community partners may have a different lens. And so sort of integrating those perspectives is really important. Wonderful. All right, so let's talk a little bit about institutional support and resources. What support from the university would really be helpful to you as you develop and implement community engaged research projects? And I'll leave this open for anyone who wants to respond. Dr. Runge.
Right, because it's on my mind, because we're rewriting the CURES grant for submission. And so my experience with the university is a very edgy one. Universities always cutting back resources and tightening their belt. And there's a lot of concern about that, because as you know, community engagement is all about building relationships. And say a center is 5 years long, let's hope you renew it seamlessly and it goes another 5 years ad infinitum. But realistically, it doesn't work that way. There are gaps between grant funding periods, and even grants change and evolve to new projects. So in order to keep those relationship bonds strong during the interim, the university, I think, should think about supporting community engagement work that is so central to these, in my case, environmental health sciences center grants that they do enjoy getting, but they, the actual keeping things alive is beyond their scope. And community members require compensation for their time. So it's not free, you know, just like we work here, okay, but I mean, they don't. So it costs money. It costs money to have a community engagement coordinator to keep those relationships strong. It costs money to have community members give up their time to work with us and brainstorm and tell us about the next idea that they have for improving public health in our city. So the university, to my knowledge, doesn't have that. You're just supposed to, you know, do the best you can, scrubbling around. And another thing that's a concern is that how is this seen at promotion and tenure time? Is this highly valued for all faculty when you go up for P&T? You know, there's a lot of desire to have this fully recognized as a point to make in promotion and tenure, but is it adhered to across those committees that review it? And so it's almost like a cultural change is required in the university. You think it's important, then recognize it as important. And recognizing means money. It's not, I like it, I like it. It's all about money and resources. And if you don't see that, it doesn't matter who likes it or what's cool about it. You damage those relationships if you don't keep that connection strong. And that's my fear, is to lose that those strong links with the diciness of the way things work. So, you know, food for thought.
Yeah, I think that's a really important point, recognizing that relationships do cost money to sustain, and it's not something necessarily that many people think about. You know, to your point of community partners needing to be paid, coordinators who nurture those relationships needing to be paid, and really sort of thinking about how we can invest resources in this work if we say that we value it. Absolutely. Dr. Miranda, did you want to add anything?
I was just going to second that, because and you really need that commitment in the leadership as well. I'm fortunate in our Department of Public Health. Dr. Patricia Wren is our chair and understands the importance of this level of engagement in the work. Because we are a new department, we are establishing our promotion and tenure factors, for example, so we can add something and are certainly discussing adding factors such as, you know, evidence of community partnership, evidence, you know, or co-authoring of manuscripts with community partners, for example. Those could all be tenure and promotion factors that departments add in if they're serious about this type of work. Also, you know, we've been fortunate and, you know, really you're needing to have dedicated faculty or staff positions, like those resources, that it's actually part of their staff role to engage in community relationships. So we were able to gain the support of our dean, Felicity Harper, thankfully, you know, to bring on board support and recognize that, you know, it needs to be a significant portion of someone's effort to be able to go out into the community and engage in these relationships. And I think the more funders highlight the importance of this work, that helps support the interest of institutional leadership in putting their resources towards these efforts.
Absolutely. I love the really concrete examples that you gave of the ways in which your department and the college are trying to integrate community engagement as a core value. So thank you for sharing that. So I want to take a few questions from the chat and related to something that you just touched on, Dr. Miranda. How much do you all see funders' views of community engagement evolving?
I mean, I think that, you know, it's becoming a standard, as it should be. I mean, I think, you know, once upon a time, you know, as other people have alluded to, you were not trained in, you know, you got your PhD, you know, you didn't get trained in this kind of work, in this kind of framework, in this kind of perspective. And I think it's critical to understand that all of us should be engaged in this work. It's not certain people that should be engaged in this work, because that's the way that we are going to involve the community and have them best, be present. And I think that that's really kind of a key factor there, is that this should be something that's a standard for everybody. And not just some people. And I think that granting agencies are recognizing that.
Something interesting I've noticed of some of the work that I do is in culturally responsive, racially equitable evaluation. And so making sure that community is part of the evaluation process, but in that we really talk about, certainly when you're engaging with funders, and those power dynamics, even when you're able to be in the same room in the funders. And so I've been working, and it can be difficult in those conversations to make sure and hold them accountable about including community throughout the process. So last week, for example, I was in a discussion and, they're talking about, okay, the community's work is going to inform this step, which is going to inform this step, but then they didn't talk about the community really engaging throughout the process. And so, I called out to them, is the community going to have an opportunity to at least respond or, guide this process along the way. And I think when we're in those rooms to really, try to continuously bring up these issues, that it's important.
Absolutely. Okay, a few more questions. Let's see what we have in the chat. So if we think about investigators who are interested in doing community engaged research, what kind of skills do you think a person needs to have? And we can think about hard or soft skills, but what kind of skills do you think a person needs to have to be able to do this kind of work well?
I think, this is one thing that I kind of observe in grant panels, and it's kind of the way that things go as there's kind of a rise of things that people say everybody should be doing this, that you start to see in grants written, but it's very pro forma, right? We are going to take this approach. We are going to do community engaged research, or we're doing mixed method, whatever it is. And I think that there's a difference between checking the box and saying that this is something that we should do. And there's a fundamental understanding that I think researchers should have and develop as a priority as to why this is important. Your research is not going to be as valuable without taking a community engaged approach, without involving that community. Yes, you can check the boxes, but I think it's kind of a fundamental sort of shift in the way that we think about research that we do, human research that we do, community facing research that we do, is to really understand and value that process and why it's important, why we want to do it, and why in some ways it's non-negotiable. It's not something that we should think about doing, but it's something that should be endemic to any research that we're doing, and then really hold that as a primary priority. Is that at the end of the day, we are serving these communities. Our job is to improve the outcomes for this community. And I think it's for these communities. I think it's really, really important to develop that understanding and have that as a tenet of your research.
Very important point, thinking of ourselves as serving the community versus just sort of the checking the box for, yep, I have community engagement in this grant, and sort of an entire shift in how we think about the importance of community engagement. Excellent point. Does anyone else want to answer that question? Dr. Runge?
Obviously, it would be great to have faculty plugged into how to talk to the public. And so that's not just community engagement, but anymore we're being asked to talk to the media as well. So to have better education for the faculty on just how to do that clearly and succinctly, without jargon, without special terms, my RO1, what's that? I mean, does everybody know what that is? So we learned in CURES by trial and error, having researchers come and speak to our community advisory boards, only to find out that it's, what they're saying is over everybody's head or full of jargon and frustrating. So it took a long time to learn, how to improve ourselves on both sides. And so it harkens back to what Felicity was talking about. Bidirectional or multi-directional communication is just so essential to all this whole process. Yeah.
Wonderful. Well, I see we're getting close to time. I want to ask one last question before I turn things back over to Dr. Thompson. So if you had to pick one thing that would be on your wish list for community engaged research at Wayne State, what's the one thing on your wish list?
I would say, I think we've talked about a number of different things, and there are things in the chat that are really essential components. One thing I would say is that a dedicated space for community engagement on campus. I think that would be a space that would be used for research. It would be used for education. It would be used for community events. And I think that we certainly have those spaces in various places around campus, but those spaces are ours. And I feel like that a large part of this research is having the community have ownership of the research process and also what comes out of that research. And so be able to have that multi-use space that may include like a kitchen to do nutrition things, as some of us have talked about. It might be a place, a gym, it might be other things that are available there, but that center the importance of community engaged research and really provide a place for the community to engage with us that's theirs, that they feel like they have a say rather than it's ours, and that we're saying, hey, you can use this.
Wonderful suggestion. Wonderful suggestion. Dr. Runge, what's on your wish list?
Yeah, that would be so great. And it would go a long way toward being more transparent to ourselves even. I get the sense that a lot of community engagement is happening at Wayne State, but it's fragmented. We don't know everything that's going on, and it's so frustrating. Oh, I didn't know this, I didn't know that. And so how are we expecting the community to know what's going on if we can't keep a finger on that pulse ourselves? So it could be a lot better coordinated and supported at the highest level. It's certainly something it's essential to a lot of big initiatives on campus. It's where things are going. So why not invest in it?
So more coordination of community engaged research projects across the university.
Right, a real go-to place, maybe support for coordinators, a centralized thing that would be a benefit to everyone.
Great.
So that's a great, oh, sorry, I was going to say that's a great transition point, if that's okay, Dr. Sneed.
Yep, go ahead.
Okay, yeah, so thank you all so much for your insight today. Thank you for the chat. I saw there's one interesting question here about mentorship programs for early career community engaged researchers. I think that's a really exciting idea, but one of the reasons why we wanted to have this kind of panel is to kind of talk about these issues, get these ideas, because this is all potentially these are all opportunities within Checkup, right? Because as we are developing the center and are in early days, we certainly have projects that we're moving forward, but we have a lot of opportunity for advocacy. And we have a lot of opportunity to build within Checkup programs or resources to help meet some of the needs that are talked about today. And while we don't necessarily need to be like the well, we recognize there's a lot of people doing this type of work across the university, but we hope to be able to maybe connect people again more efficiently, more effectively, people who are doing this work, so that we know what's happening. We have a better sense of what's happening across the university and the different partnerships with our community. So here, please complete our evaluation, join our email list. Our next program that we'll be having is April 27th, where we're going to be talking about actual tools and strategies around partnership. How do you kind of go from these ideas about partnership and really move it into action? And we're trying to offer practical tools and steps for doing that. So that's April 27th. It's going to be at Fellowship Chapel, Banquet and Conference Center on Outer Drive. And we'll have dinner for you there. So please join us. And then on May 18th, we'll be doing funding strategies for community engaged research and for building these type of partnerships. So I know that's funding is an important piece, as we talked about today. So we'll be discussing that as well. So I think thank you everyone, and have a great rest of your day.